Assalamualaikum warahmatullahi wabarakatuh and welcome everyone to our discussion today. So today we all gathering here to discuss an interesting topic related to radiation protection. But our main focus is the major concern of radiation protection in radiology. As we all know, radiation is harmful yet useful for patient treatment and diagnostic purposes. Before we move on further with our discussion, we shall have a short get to know session with our panel today. So the first panel is Wan Rusaiza binti Sukri. How are you today?
Hi, I'm good and glad to be here today.
Okay. And next, our second panel is Nurasha binti Razali. Thank you for joining us today, Nurasha.
Yeah, I'm honored to be here too. Thank you.
Then our third panel is Mr. Ahmad Hasimi bin Nazari. And
Hi, I'm glad to be here. Thank you.
then our last and fourth panel is Mr. Muhammad Firdaus bin Nur Azman.
Hi, all. Thank you for inviting me.
Okay. And lastly, me myself, Aina Nabila Minta Rahman, as our host today. So, as I mentioned it earlier, we are here to discuss the major concern in radiation protection in radiology. We all know patients and personnel will be exposed to the medical exposure during procedure, either for treatment or diagnostic. We all know radiation is harmful and can cause an effect to our body, but we are not immediately affected by it. Because of that, we should know and learn how radiation affects us and how we can reduce it. So to know better, we should first know different exposure that expose while medical exposing procedure. Therefore, I appoint Ms. Wan Nur Suhaita to explain more regarding the exposure.
Thank you, Ms. Moderator. Assalamualaikum warahmatullahi wabarakatuh. And when we talk about radiation exposure, one of the first things that come to mind is how to keep ourselves from being exposed to it, right? When it comes radiation exposure, there are three types of exposure to be aware of: medical exposure, occupational exposure, and public exposure. Medical exposure is exposure to patients who are exposed for the purpose of medical or dental diagnosis or treatment. Occupational exposure is the exposure for those involved in the performance of radiological procedure, for example, nurses or physicists, and public exposure is the exposure for members of the public, such as in waiting room.
Thank you, Ms. Suhaila. So basically, the three type of the exposure, the exposed, which is the medical exposure, occupational exposure, and public exposure. So, Ms. Suhaila, can you elaborate more on medical exposure and its effects?
As I know, medical exposure differ from occupational and public exposure in that person. Often patients are exposed to radiation voluntarily, freely, directly, and consciously for their own benefits. Several types of imaging used for medical exposure are X-ray, CT scan, fluoroscopy, and many more. Those limits are unsuitable in medical exposure since there may limit benefits to patient. But if we do not apply radiation protection effectively, that person as well as others involved in occupational and public exposure will be affected. The deterministic effect and the stochastic effect are two types of health effects. The deterministic effect is described a short-term health effect that occur after threshold dose is reached. The severity of the effect increase as the dose is increased. For example, skin reddening. And last is stochastic effect occur by sta- statistical chance. The severity of the effect does not depend on the dose. Cancer is the most common stochastic effect that can occur as a result of radiation exposure, and it can occur several years after the exposure.
So thank you for your explanation, Ms. Mansueza. So basically, for medical exposure, we can be affected, and the type of health effect that can affect us, which is the deterministic effect and stochastic effect. And it depends on the amount of radiation dose that received by the patient or even the person itself. Thank you, Ms. Mansueza. And move on, in imaging or treating patient, an expert will guide and handle the patient to ensure the patient's safety and even their own safety. But who are the experts? Do we know the person behind all this? So for that, I would like to ask Ms. Nunasha, who is the main person in charge during a medical physicist, during a treatment or diagnostic of patient.
Okay, thank you for your question, Miss Aina. The back to the question is, who is the main person in charge during treatment of patient? Basically, there are two main person who are medical physicists and also radiation safety officer. Of course, together with medical doctors or specialists who are in the earliest stage of diagnosis of patients treatment.
Thank you, Ms. Nonasha, for your explanation just now. So basically, both them are responsible in radiography field. But can you explain more about them and what is the main difference between both of them?
Uh, that is such a great question because most of us thought that people who are working in radiography field are only radiographers. In fact, there are a few other important personnel working in the same field, which are medical physicists and also radiation safety officers. These two job scope are not the same since medical physicists are person who are responsible in areas of imaging equipment, imaging procedures, or also administrative and regulatory aspects. Meanwhile, radiation safety officer usually will look into any defects or malfunction of equipment or procedures, or maybe they can uh, improve the procedures or equipment that has been using for a long time. Other than that, medical physicists also responsible in diagnosing the treatment procedures of patients while ensuring the safety of patients at the same time. And radiation safety officer usually involved in advising managers on situation related to application of radiation. In some cases, medical physicists also can involve in a research or development of skill or requirement needed that to minimize patient dose. Radiation safety officer will never take part in any research conducted since it is not one of their job scope. Last but not least, radiation safety officer, it is very important for them to have a specific license or qualifications depend on the type of materials they are handling. In our country, a course was organized by Agency Nuclear Malaysia is provided to be attended by radiation safety officer that in the course will be covered from basic information on ionizing radiation, radiation safety audit, radiation protection organization and program, and as well as many other syllabus. Meanwhile, medical physicists, it is not compulsory for them to attend any courses. Radiation safety officer should be the person who has complete extensive training and has enough experience since it is crucial for them to take care of other safety. Both medical physicists and radiation safety officer are very important in radiation protection since they are the one who responsible to protect everyone from unnecessary dose exposed.
I see. Okay. Thank you for your bright explanation, Ms. Nunasha. So from your explanation just now, what I can say that the main difference that differ that differs from radiation safety officer and medical physicist is radiation safety officer need to attend specific courses to be a radiation safety officer rather than medical physicist which not has a specific needs to attend the courses. So thank you, Ms. Nirasha. So now I would like to know, do we have any institution that give guidance or even related to radiation protection?
Yes, Ms. Aina. We do have the international institution that on the radiological protection, which is International Commission on Radiological Protection, ICRP.
Oh, I see. From the ICRP, which is the International Commission on Radiological Protection, could you tell to explain more about ICRP and the main function?
Okay, thank you, Ms. Aina. From the historical of or the background of ICRP was established in 1928 at the second International Congress of Radiology. The International Congress of Radiology was held to respond on growing concern about the effects of ionizing radiation when the region found the X-ray and many researchers doing experiment causes the skin cancer. At that time, at 1928, it was called International X-ray and Radiation Protection Committee, IXRPC, and it was then restructured in 1950 after the World War II. It was named International Commission on Radiological Protection, ICRP. In 1988, the ICRP was registered as the charity, registered charity. With ICRP, main commission members are charity trustee. ICRP was founded by voluntary contribution and independent of government influence. They have many community, more than 215 globally recognized experts in their commission, which as expert in radiological protection science, policy, and practice from more than 30 countries. ICRP also have main comprise of the main commission, a scientific secretariat for standing committee, which is focused on the effects of the radiation, dose, medicine, and application of the radiation, and also have the series of task group, which is carry on the study on the radiological protection. The recent chairman is Werner Room. It was recent the chairman right now. The commission was formed to develop guidelines and units for radiation protection. It also has a task to publish data that can further the field of radiation protection. Originally, ICRP, we published the recommendation when they have like the Congress, something meeting about some topic, and we publish in Annals of ICRP. This recommendation of ICRP will become the basis of radiation protection regulation in most countries of the world. For example, ICRP Publication 60, which is defined on philosophy, underline radiation safety, give intensive rationale for scientific basis, and provide practical recommendation on that year, on the recent years. But interestingly, for the first publication from the ICRP already underlying three principles of radiation protection, which is justification practice, optimization of protection, and individual dose limits, which is this principle become the basic principle to manage the radiology application. So right now the latest publication is ICRP publication 150. The topic is about the cancer risk from exposure to platinum and uranium. I think that's all from the about the SCRP.
Thank you, Mr. Hakimi, for your crystal clear explanation. So from the explanation just now, we know ICRP stands for International Commission on Radiological Protection. And it is a registered charity and funded by voluntary contribution, and it is independent of government influence. And it was formed to develop guidelines and units for radiation protection. And it recommend some of justification of practice, optimization of protection, and individual dose limit. So now we know almost everything related to radiation protection, but we also need to have a knowledge regarding how to reduce the risk from the radiation risk. By that means, I will need help from Mr. Fitaus to tell us a little bit about a well-known principle that have been globally known. So, Mr. Firdaus, would you care to tell us more about it?
Yes, sure. Assalamualaikum. All right. So before that, I would like to share screen.
Yeah.
Wait, can you see?
Yes.
Okay. So, all right. So now we go first to the Alara. So when Aina said well-known principle for radiation protection is Alara. It stands for as low as reasonably achievable. It means that even if in a small dose, if receiving that dose has no direct benefit, you should try to avoid it. So when Hakimi said ICRP is introduced in 1928, and Alara was introduced under ICRP since 1977. So it's about how we can reduce and protect ourselves from unnecessary exposure. There are three basic protective measures in radiation safety, which is shielding, time, distance. So first we go to shielding. Okay, shielding is to block any radiation is depend on what type of radiation is, such as alpha, beta, and gamma. But we often use lead for shielding because lead have high atomic number and density, so that it can block those three radiations simultaneously. And next we go to the time. Okay, so time it's about how long you're exposed to the radiation. The longer the time you expose, the more the radiation will affect to your body.
So sorry, Mr. Firdaus, can I interrupt you for a second?
Yes, sure.
May I know about the time exposure, Mr. Firdaus?
Okay. There are two types of exposure, which is acute and chronic radiation exposure. Acute is when we expose to a large dose radiation in a short period of time, while chronic is when we expose over a long period of time, but with a small dose radiation. Okay, let me continue. The last point is how we can reduce the radiation is distance. Okay, imagine that if we have a long distance to travel, so we will lose energy along the way to travel. Same as radiation, it also carries energy, and the longer the distance, the lower the energy become when it travel, and the lower the radiation will be. So we should avoid from stay near the source of radiation. Just a little bit, I just want to add some. Did you know that there was so many radiation accident in the history, such as Chernobyl accident in 1986?
Yes.
It was a nightmare for Ukraine at that time. When it comes to this, government play an important role to take an action to protect their residents. But it was a mistake when the announcement to the resident is too late. So many of them suffer from radiation poisonous. There are 4 groups who are being exposed to the radiation. Group 1 is the person involved in the clean-up operations at the Chernobyl nuclear power plant. And group 2 is person evacuated from the exclusion zone in 1986. And group 3 is the persons resident in the territories monitored or resident there immediately after the accident. And group 4 is the children born to parents in group 1 until group 3. So there was another radiation accident. It is Tokaimura criticality accident in Japan, 1999. It involved a man named Hisashi Ouchi, who we can know him as the most radioactive man in history because he survived for almost 83 days. The accident happened due to the miscalculation and he handled the liquid uranium improperly. You can see how he managed to fill the uranium into the container. And suddenly a blue light or Cherenkov radiation emitted. That means the liquid uranium reached critical point and directly exposed to Ouchi. Can you imagine that? It was so dangerous and frightening when you directly exposed to the radiation. He survived with critical damage to the DNA and all of his body tissues damaged in 83 days before he dies. The main point I want to tell you is that we must handle radiation source with care and please practice 3 basic principles of radiation protection. I repeat again, which is STD, shielding, time, distance. Okay, that's all from me. Thank you.
All right. I think all right, thank you, Mr. Fidas, for the reminder, which is we should handle radiation source with care and practice 3 basic radiation is STD, shielding, time, and distance. So, from our discussion just now, I can summarize that radiation is harmful, but with precaution and recommendation, it gives us many benefits. So, as long as we follow the guidance and precaution set, with some of its involved Alara, with that mentioned by Mr. Fidos just now, is reading time and distance, and also by the recommendation guideline that provided by the ICRT, we can reduce the risk, but reduce the risk from the health effects that mentioned by Ms. Wan Suheza, which is the health effect that can affect a patient or even the person itself, which is the deterministic effect and stochastic effect, which is we should reduce it because radiation is harmful and we do not want to become like Mr. Hisashi Oichi, like the Mr. Fidos mentioned just now. So also, we should know behind our radiography, behind our radiography, behind our radiography field, there are person that in charge that is important that we almost forget about them, which is the medical physicist and radiation safety officer. Without them, maybe we are not safe even we are exposed in radiation when we doing some X-ray scan or CT scan. Maybe without them, the radiation exposed will not safe. Okay, so I think that's all for today. Thank you to our panel for joining this forum today. I think that's all for me. Thank you. Bye-bye.
Bye.